Hi, welcome back to Self-Defense 360. This is going to be episode 3 of Oh Shit Medicine. This is going to be a shorter episode. We're going to go over airway and breathing. The unfortunate part of airway and breathing is that as important as it is to survival, without advanced training and actual equipment, there isn't a whole lot you can do. But we're going to be covering stuff that you can do. Unfortunately, I'm not going to teach you anything invasive. I'm not going to teach you how to improvise a trach or anything like that. When it comes to airway, you're going to look for two things. One, position, and two, obstruction. All right? Is there a positioning thing, either with a dressing you put on or just something is around their neck that is cutting off their airway, or just they're at an awkward angle and can't breathe properly, or is there an obstruction? Is there something in their throat or in their mouth that's keeping them from breathing? You won't see that a lot in like a traumatic scenario, like a shooting. But let's say you're in the middle of taking a bite of a big old cheeseburger and you get into a car accident and there's something lodged in your passenger's throat, or you're in the passenger seat, your driver, whatever it may be. So you're going to look for that. You're going to try to get it out of there. All right. As far as positioning goes, I'll show you that. And then we're going to take a look at the thoracic cavity, your chest and back, and show you how to manage certain injuries that you'll find there. All right, so without further ado, pitter patter. I'm going to do a real quick demonstration of a head tilt chin lift, because that's really the only kind of airway clearing maneuver I want to show. So let's say someone got hit, they fell over, and their chin is tucked down and it's obstructing their airway. All right, or something else happened, it's obstructing their airway. Head tilt chin lift. You're just going to grab under their chin, lift their head up into a sniffing position, and allow their mouth to open up. This aligns their airway so that air can get in and out with ease. Okay? If there's an obstruction in there that you can reach, then pull it out. But don't stick your fingers in their mouth, because if they wake up during that and they take a chunk of your finger off, now you're obstructing their airway. Okay? When it comes to airway also, if you ever have a patient who starts seizing for any reason, head injuries are a common cause, choking can cause seizures, things like that. Anytime there is seizure activity, you need to make sure you put the head in the same position and then turn the patient on their side and just bring their arm up and rest their head there so it's in a neutral position. All right, this is called the recovery position. Their leg will also be up, but since we aren't lying on the ground right now, this is the best demonstration I can give you. All right. Now, again, if you've applied a bandage and it's obstructing the airway, you're just gonna grab part of it, take it off. If there's anything around their neck that's obstructing their airway, you're gonna undo it or cut it off. All right, use your scissors or pocket knife, tear it off, whatever you need to, because they need to breathe. Okay. Now, when it comes to breathing, if there's a traumatic injury that is causing a problem with your breathing, it's most likely going to be one of two things that you can actually fix or treat. One is a flailed chest segment, and the other one is a penetrating chest wound. Okay. If you break a rib and it punctures your lung, best thing you can do is just wrap it, but they need surgery. And I'll show you how to wrap it. But a flail chest segment means that 2 or more ribs were broken in 2 or more spots, and when you breathe, there's going to be a spot on your chest that doesn't move the same with the rest of your chest as you breathe. That starts building up pressure inside your thoracic cavity, inside your chest, restricting your lungs from expanding properly so that you can breathe. Okay? That's called a flail chest segment, like I said, and I'm going to show you how to treat it. So you have ribs, they attach along the spine and they wrap all the way around to the sternum. Let's say these 2 ribs right here are the ones that are broken, all right, causing a flail chest. She can't breathe. What you're going to do is you're going to take gauze or your improvised gauze strips, a shirt, something like that, and you're going to pack it over that wound or over that segment, okay? You're going to hold it tight, but not too tight, just firm. Because what you're doing is you're trying to keep those pieces of rib from moving, all right? So that they are in a set place, and then you're going to wrap it. So you put it there, and then you take an ace wrap, and you wrap around it, all right? You can also use one of those emergency bandages. Have them hold it there if they can. Alright. You can also use one of those emergency bandages and wrap that with it. But the key here is you want to keep the different parts of the chest moving all as one unit. All right. Now, when you wrap this up, it doesn't need to be super tight. In fact, you don't want it super tight because you want them still to be able to expand and contract their chest and be able to breathe. All right. Like I said, it just keeps everything moving as one unit. Causing less damage to the tissues underneath. Okay, so the second type of chest wound that you can really treat that is potentially fatal is a penetrating or sucking chest wound. This is usually from a gunshot or a stab wound where they don't leave the knife or whatever in their victim. It creates a hole through the chest wall that air can get into, and it can end up collapsing your lung. So the way we stop that is we have to stop air from getting in. For this, we're going to end up using that plastic packaging I showed you before. If you improvise, you can use any sort of like sturdy plastic, like a Ziploc bag, shopping bags, or anything like that, and then some heavy duty tape. Scotch tape isn't going to cut it, painter's tape isn't going to cut it, but like duct tape definitely will. And my personal favorite, 3-inch medical tape. So let me show you what I mean. For this, I'm going to have her turn around just because I have more surface area to work with. Thoracic cavity wraps all the way around, and anywhere where if you go through you're going to find the lungs or the heart is a penetrating or sucking chest wound. So let's pretend she got shot here, or she got shot in the front and it exited through there, so there's a big hole. We have to stop the air from getting in. So the first thing we do, we take our hand and we put it over the hole. Alright? Especially if it's gloved. If you have gloves, use them. But if not, put your hand over the hole. Make sure no air gets in there. Next, you're going to take your improvised occlusive dressing. Now, they sell chest seals, and the chest seals work great. But like I said, most people don't have chest seals. I hoard medical equipment, and I don't even have any chest seals on me to use. So we're going to use our piece of plastic from the pressure bandage. Alright, now we already covered it with our hands, so we're just going to cover it with that piece of plastic. You want 2 inches around the hole in order to make sure that it completely covers it. And then you're going to take your tape and start taping. Now, for me personally, I like taping 3 sides so that I can burp the chest if I need to. Alright? And just like that, it's sealed on there. Now you want this as tight as possible, but air is going to try to escape because as she breathes in, her lungs are trying to expand and push that sucked in air out so that the lung isn't collapsed. This will probably clot off from blood, but until it does, you can pat it or rub it to try to let that air escape. Yes, it's painful, but better than a collapsed lung. That's it on penetrating or sucking chest wounds. Next thing I'm going to go over is cracked ribs. That's going to be really simple. It's just going to be an ACE wrap to keep everything tight, but I'll show it to you anyways. Alright, so next up is a broken rib. A broken rib that has a complete break can be very dangerous. It is able to puncture the pleural cavity and puncture a lung, causing a collapsed lung. Alright, this will usually be in blunt force trauma. The most likely case you'll see it is either a fall or a car accident, but it can happen in any sort of scenario. The fix to it is really simple. You just wrap it so that it's as stable as possible. Unfortunately, you can't really splint a rib. It doesn't have the same sort of bone or same sort of structure that an extremity bone would have, where you can just like lay something flat on it and wrap it. But by wrapping it, you're kind of keeping it as secure as possible so that it doesn't cause further damage. Alright, so let's say she got hit on the side and it broke her rib. Okay, I like to start on the injured side so that you get that initial pressure on it instead of it just being transferring. It just makes it more secure, in my personal opinion. Alright, so you're going to wrap it around. You want it to be firm but not super tight. Alright, if it's broken and there's sharp pieces, then you don't want those sharp pieces to go further into the body and cause more damage. Alright, you want to go at least 2 ribs up and then at least 2 inches below. Let's say it's a floating rib, there's no ribs below it to support it, so you're going to have to go a little bit below so that it kind of pushes it up where it needs to be. Alright, go ahead, hold that. Just hold the, hold this. Alright. Now most ACE wraps come with clips, but we already lost those today. So we use our medical duct tape. Alright. Put one on just to secure. And then I like at least one more just for safe measure. Alright. There will even be cases where if I really need it, I'll go all the way around once, but it doesn't seem to need it in this case. So that's really all there is on securing a rib, or just wrapping up the rib cage in case there's blunt force trauma there. That's all we can really do when it comes to airway and breathing. The only other thing we could do for that is if there was a stab wound and they left the knife, ice pick, screwdriver, whatever in the victim, but that will be considered an impaled object. And when it comes to impaled objects, we secure it to the person. Taking it out will only cause more damage. It can rip arteries, it can make someone bleed out. So what we do is we secure it and we let the surgeons deal with it. I'm going to go over that in my splinting video, which will be up next. I appreciate you joining me. If you have any questions, comments, please leave them below. Like, share, and subscribe if you like the video. Until next time.